So how does anxiety manifest itself differently in teens that are on the autism spectrum? And what you see as a parent might look a little bit different than what you might see from a neurotypical teen in regards to their worrying and worry-like behavior. So one thing you may see in your teen is a lot more repetitive behaviors or engaging in their fixated interests. So if they're engaged in something and they're doing a deep dive on something that they're really interested in, this could be a sign that they're seeking comfort from what they enjoy versus dealing or coping with the fear. Another thing to look out for is just sudden meltdowns or shutdowns that are disproportionate with the situation when they weren't necessarily doing that before. They just seem way more on edge. Another is sleep disturbances or differences in their eating patterns to where maybe they're eating too much or too little, or sleeping too much or sleeping too little. They've gotten off the schedule. And another one is an increased need for rigidity in their routines, whereas before they may have been more open to different transitions and changes in their routine, but now they're not. And it is a big deal that you're not going directly home after school, or that you have to run this small errand, or what you said was going to happen this next weekend didn't happen. Now it's a big deal, whereas before they were able to deal with it. And another thing to keep in mind is autistic teens tend to have a more difficult time identifying and talking about their emotions, which makes dealing with anxiety even more difficult for them. So what may appear as a behavioral problem really may be their attempts to try and cope with their anxiety. So let's get into some ways that you can support your teen.